Are you considering fibroid surgery to improve your fertility? Today, we're diving deep into what you can expect after surgery. We'll cover everything from the recovery process to when to start trying to conceive. If you're new here, I'm a board-certified OB/GYN and pelvic surgeon, and I make content on all things periods, pregnancy, and everything in between. So make sure if you like what you see, you share this with your friends. So, if you've been following for a while, you know that I've had a very public journey of trying to get pregnant with my son. And ultimately, it took multiple surgeries and procedures to ultimately achieve that goal. If you haven't watched those videos, make sure you check them out. But ultimately, one of the reasons I was having difficulty getting pregnant was because I had multiple large uterine fibroids. Uterine fibroids are very common. 20 to 80% of women will have fibroids by the time they are 50, and most of the time they are very, very silent. They don't cause any symptoms, and oftentimes people will find them incidentally on ultrasounds done for other reasons. However, in some people, they can cause significant pain. They can cause heavy menstrual bleeding, sometimes even affect your fertility. And so, if you're struggling to get pregnant and you have fibroids, it is a very reasonable next step to consider removing them to see if that improves your ability to get pregnant. So let's talk about exactly what that looks like, what you can expect if you do decide to proceed with surgery for your fibroids. So there are many different types of surgeries that can be offered to you. Most commonly, it's either going to be a hysterectomy, which is an abdominal or vaginal removal of the uterus, or a myomectomy, which is removal of the fibroids while preserving the uterus. Myomectomy can be done either through an incision in the abdomen or through a minimally invasive approach with laparoscopy. In general, the recovery from either of these surgeries can be quite lengthy. In the case of a hysterectomy, you can expect to take about 6 to 8 weeks off from work. In the case of a myomectomy, if it's done laparoscopically, you can expect to take 2 to 4 weeks off from work. And if it's done through an open incision, more like 6 to 8 weeks. What does that look like? Well, in terms of pain, typically, if you've had an abdominal surgery, you're going to have incisions that will hurt. You'll have pain medications that you can take. And in general, pain after surgery is pretty well controlled. Usually, people don't experience terrible pain after surgery, but it is certainly uncomfortable and something you need to plan for. The other thing to think about is activity level. So after major surgery like this, you will need to be relatively sedentary for the first few weeks. You'll probably need to avoid heavy lifting. You'll need to take it easy. And this can be really difficult, especially if you have kids or a very demanding job. So just keep this in mind as you're planning for this surgery. Make sure you have adequate time to recover, and make sure you have support at home to help you with daily activities. Typically, you will be able to resume sexual activity once you feel comfortable. There is no specific timeline for this. It's usually within a couple of weeks to a couple of months. And when should you start trying to conceive? This is a question I get asked all the time. And the easiest answer is to say 3 months. However, it depends on a number of factors. If you've had a myomectomy and you've had your pathology back and it shows that there was no residual disease left behind, you may be able to try to conceive much sooner. However, if you've had a hysterectomy, you've had your tubes tied, then obviously you will not be able to get pregnant. So make sure you have that discussion with your doctor beforehand. Bottom line is there is no perfect time to get pregnant after fibroid surgery. It's really an individual thing and depends on how your body bounces back. Lastly, what are the risks? Well, any surgery has risks. There are risks of bleeding, infection, and things like that. In addition, if you have a hysterectomy, there is a risk of things like vaginal dryness and things like that down the road because you no longer have ovarian function. However, overall, the benefits typically outweigh the risks. And for most people who go on to have surgery for their fibroids, they do go on to have successful pregnancies after that. All right, thank you so much for being here as always. I hope you enjoyed this. And remember to take care of yourself because you're worth it.